Thank you very much. And I want to start by saying big thank you to the organisers of this conference. Amazing. I mean, told it at the RSM to have these fantastic speakers. It's a real achievement. And a special thanks to Helen, with whom I've worked for several years. And although you're not in clinical practice anymore at UCH, I'm still seeing some of your patients who all remember you very, very fondly, because you always gave everything to them to support them in their journey. And I guess that many of the patients and their families are in the other session at the moment, talking about education, employment, rehabilitation, because these are really crucial subjects. I'm going to talk about fertility in about 5 minutes. As an obstetrician and gynecologist, you know, we're quite practical people. And I'm going to start simple in a way that I can understand it and can explain it in clinic. We can go on from there if you've got questions. So I've lumped together the hypothalamus and the pituitary as being the control centre. I'm just going to run through quickly what hormones do you need for sex and fertility. So, pituitary does the same thing in both sexes. In boys, sends messages to the testicles to make testosterone, girls to the ovaries to make estrogen. And the brain makes your body ready as you grow up for sex and reproduction. And of course the physical changes we call puberty that happen in boys usually sort of 12 to 14, girls a little bit earlier, 11 to 13. And the pituitary gland sends out these messages initially at night and then in this wonderful pulsatile fashion, not like a little clock ticking, that tells the rest of the body to grow and develop. Now, there are other glands involved, such as the adrenals, but I'm just going to stay quite simple with this and say these are the key hormones. So if you're born a biological male, you will make testosterone, biological female, you'll make estrogen. And testosterone is going to make you grow more muscular, develop body hair, deeper voice, and it also makes the penis grow so you can have sex, and it gives a sex drive. So if you're biologically born a female, then estrogen's the main hormone, and it makes you grow breasts and wider hips and a female figure. It starts your periods, and it makes the womb and the vagina grow and develop so that you can have sex and you can carry a baby. And if your body doesn't make these hormones, you can take them. And it really is highly successful. And so I would think quite a few people here will have had treatment for induction of puberty. So that's the good news, actually, that these hormone replacement therapies work very well. It's also important to know that sex and fertility don't necessarily go together, and these hormone treatments do not guarantee fertility. But they are important lifelong. They're important for your health as an adult, for your bone strength, for cardiovascular health, for cognition, for energy as well, actually. So you'll take them even if you're not interested in fertility. It's important to take these hormones. Now, the same system drives fertility. You've got the hypothalamus and pituitary sending the messages to the testicles, and they make sperm. Or they're sending the messages to one's ovaries, and they'll make eggs. The two sexes are a bit different there. In the testes, there are stem cells, and they bud off new sperm all the time. They make literally millions. You can make millions in a day. Whereas ovaries in women hold all of their eggs. They're there actually before the girl's born. And in adult life, they're just sitting there waiting for the right time to grow, mature, and be released in ovulation. That affects the sensitivity of the testes and ovaries to treatments like chemotherapy. So, well, what if you have a hypothalamus and pituitary that doesn't work very well? Perhaps after surgery, perhaps radiotherapy, for example, for a craniopharyngioma. It may not send these messages. It's like coming in here, I couldn't download something because I couldn't get the Wi-Fi. If your Wi-Fi goes down, you haven't got a signal. So, you know, my phone's still in my hand, the testes and ovaries are still fine, but they're not driven to work. Now, it's possible to take these pituitary hormones as a treatment. So, if you have an underactive pituitary and you want fertility, we can reproduce the signals by giving FSH and LH, follicle-stimulating hormone, luteinizing hormone. It's very similar to growth hormone. And the patients I see who come for these treatments have almost always had growth hormone when they were younger. So they're used to the idea of an injection under the skin taken for quite a long time. Sperm production takes months to set up. It might be more than a year of regular treatment, maybe 2-3 times a week, subcutaneous injections. Because the eggs are held in the ovaries at a different stage of development, actually it's quicker. It's only about 3 weeks usually when you start pituitary replacement for ovulation to get to that point. It just takes a little while to wake up. But it is a bit more complicated than that after having a brain tumour, because some children will need chemotherapy as part of their treatment. For example, for medulloblastoma, they might receive quite high-dose chemotherapy, and that goes around the whole body, and so it can have a direct effect on the testes or the ovaries. So if I put a little cloud over them, actually the problem then is in what we call the end organ. Now that can't be treated with hormones. You might pour in the hormones, but the testis or ovaries might still not be able to respond. But it can nowadays be treated with assistance. And for men, if the sperm count is low, IVF is the answer. We can do IVF even with extremely low numbers of sperm. For women, if the egg count is low, it's trickier. And if egg count is very low or there are none, or if there are no sperm, then you need to think about donated eggs or sperm to have IVF, and that has very high success rates. So, as I said at the beginning, fertility and sex are two slightly different things, and actually you can have fertility nowadays, doesn't always need sex. I have a lot of potential pictures about assisted reproduction, and I've only put up a couple. So you can see some sperm here down the microscope. This is a counting chamber. They are so tiny, they dart about, and the technician has to count them in little squares and multiply it up to get the millions. And these are some eggs extracted during an IVF process, and this is under the microscope doing the insemination. So I've kept that quite short. Thank you for listening. I hope it was reasonably clear. We can take it on from there if you've got questions, or over tea, especially if people want to come and ask about their individual situation. Okay, thank you.